Tell me what you know about subfascial augmentation.
Well, I've heard that it's better and gives a much more natural look.
Okay. And do you know much about subpectoral?
No, I don't.
Okay. So this is a depiction of a subpectoral augmentation. Although typically surgeons cut the muscle here, which lets the muscle bunch up here. And the reason they do that is there's a thought that it gives increased upper pole fullness. The tone of the muscle, however, pulls down on the implant and creates this kind of scooped out look usually very early in the augmentation. And if you look at the frontal view, if this is midline, the pectoralis major muscle, which usually lives here, is cut and then lives about here. Because they leave this area of the origination in place, when the implant's placed, the implant has to sit far away from the midline, which creates this trough that you've probably seen in augmented patients. It's like a plateau here between the breasts, which is not a natural look. But what hurts things even more is that every time the arm moves, this muscle contracts and pushes the implant this way, and eventually ages out laterally and low. The difference with subpectoral augmentation is that I enter through the armpit, called transaxillary, and then enter this space between this white stuff called fascia and the muscle itself. I dissect this exact layer, never entering the breast, never entering the muscle, and lift this fascia to hold the implant.
Okay, and what is fascia?
Fascia is a strong layer that lies over every muscle in the body, and it's a strong connective tissue layer that forces can be applied through. So by using it to hold the implant, it's like having a bra inside your breast.
Oh, okay.
So the fascia then drapes on top of the implant, and this tissue right here is lifted up with the fascia, creating a more natural teardrop breast shape. Whereas the submuscular, with the abnormally originating pectoralis major, ends up being here and actually pulling it down, creating a scooped out look and a widened base of the breast. The fact that fascia is around the implant catches a lot of gravitational force and prevents it from exerting on the breast and getting what we call bottoming out. And those are the main reasons that I choose subfascial augmentation and come like depicted here through the armpit. So I enter in that space, get underneath the fascia, and then tailor my augmentation so it's round at the bottom and narrowed at the top like a natural breast. So in the end, we have a breast that has more of a teardrop shape and has internal support.
Oh, that's great. That's exactly what I'm looking for.
Great.
A very natural look.
You can see here that you can't tell exactly where the implant starts. It's a nice gentle slope, And there's nice sharp definition here, round at the bottom, and narrowing into the axilla, like a natural breast. Although these breasts are somewhat large for the woman, they could easily be natural. And that's the goal of the subfascial augmentation.